Hi, today we are going to be talking for the setup for an intubation using the SOAP-Me acronym: suction, oxygen, airway, positioning, medications, and equipment. Starting off with suction, we need to make sure that we have a double 2-suction setup. We will be using Yankauer hard suction. I have one prepared on my right and a second one ready on my left. Remember that suction is a closed circuit setup, so we need to ensure and check that all parts of the circuit are working before we use it. Namely, that the suction is turned to on, that the tubing is connected from the suction unit to the wall and turned on, that the vacuum is connected, and that the suction tubing itself is connected. I keep my suction easily available under the mattress on my right hand side. Next, we move to 3 sources of oxygen. The first being regular nasal cannula that we turn all the way up to 15 milliliters per minute. The second is face mask with a reservoir turned all the way up as high as it would go, ensuring that the reservoir inflates, that the holes on the side of the mask are covered, and that the elastic is appropriately fitted. And then the third is to make sure that we have our bag valve mask, again checking the closed circuit, that the oxygen is connected to the correct source, that the bag inflates, that the PEEP valve is secured correctly and turned to 5 to 10 centimeters of water, that we are connected to a viral filter to protect against viruses such as COVID, that we have an end-tidal CO2 detector connected to a face mask as close to the patient as possible, and that if it is an inflatable mask, that the mask is inflated as required. We then move to our airway equipment setup, checking that we have a McGill's forceps to ensure easy removal of foreign bodies as soon as they become visible. If we are using direct laryngoscopy, to check that the light on the laryngoscope is working and that the blade connects easily. Make sure we have a guide for easy insertion of the tube. A tube, usually in at least 3 sizes. Over here I have chosen a size 7.5, so I would ensure that I also have a 7 and an 8 available. A 10 cc syringe to inflate the cuff of the endotracheal tube. Lubrication gel for easy insertion of the tube, and something to tie the tube with. In addition to this, we talk about backups for A, B, and C with regards to our airway. A being alternatives, so failing easy view with direct laryngoscopy, we can also ensure that we have a video laryngoscopy setup, or that we have rescue devices such as LMA, and then I also over here have an eye gel. In terms of the B, a potentially blind view, we need to also make sure that we have backups. Again, using the LMA, we can continue to go completely blind, or we can stay partially blind and use a bougie. And then we have a surgical airway as the rescue for the cricothyrotomy, the C, where we need a blade, a marker pen to mark the positioning on the neck, the bougie, and the endotracheal tube. Moving back to the positioning, we talk about positioning of the operator and positioning of the patient. For the operator, the bed needs to be at the height of the operator's navel. The head of the patient needs to be as close to the end of the bed as possible, and elbows need to be tucked in to ensure mechanical advantage. For the patient, eyes should be parallel to the ceiling, so eyes to the sky, ear to sternal line. Ears and sternum need to be in alignment, and we need to raise the head of the patient so that the head is not hyperextended in the sniffing position, but rather in a neutral position. We can use assistive devices to achieve this as necessary. Following on, we need to consider our medications. Specifically with regards to rapid sequence induction, we need to ensure that we have an induction agent, a neuromuscular blocking agent, and then rescue medications such as push-dose suppressors, and for special considerations such as neuroprotective intubations, specific pre-medications. Medications will be discussed further in a later video. We then need to consider the final E, which is our equipment, such as our end tidal setup, which we've already spoken about previously, and our ventilator and other equipment.